Hi, this is Tammy. I am recording for NU664. We're talking about Adeline this week, and she's a 42-year-old G2P2. She says she's been experiencing painful, heavy menstrual bleeding and bleeding between her periods for about the past 3 months. She's 5'3", 180 pounds. She's having a bleeding episode today and requires evaluation. So, history of her present illness: she's a 42-year-old G2P2 obese female. She's been experiencing painful, heavy menstrual bleeding and bleeding between her periods for the past 3 months. Chief complaint: she's currently bleeding today. She desires evaluation. Subjective data: I'm going to get a past medical and surgical history, past illnesses, hospitalizations, and surgeries, particularly her gynecological surgery history. Her obstetric history, including the dates and courses of her pregnancies, type of delivery, whether they were SVDs or C-sections, any occurrence of postpartum events such as postpartum hemorrhage requiring surgical intervention, or if she ever had an infection from any of her pregnancies. Her menstrual history would include the following information: the date of her last menstrual period, any symptoms associated with menses such as pain before this 3-month period, interval between menses, duration, characteristics of flow. Has it usually been pretty normal, or has it always been on the heavy side? Has it gotten heavier over the last 3 months? What occurred 3 months ago to increase her pain and the amount of her bleeding? Is the bleeding related to any activity such as intercourse? Is it interfering with her daily activities? On the heaviest day, what is her pad or tampon count? Does she ever need to change her pad or tampon at night? Are there any large blood clots that she's passing? Has she ever been told she's anemic and it's related to her menstrual cycle? Are there symptoms of ovulation present, such as ovulatory mucus or breast tenderness noted? Any systemic endocrine changes like virilization, hot flashes, breast discharge, or abdominal or genital urinary pain, which could signify an infection or a mass? Any symptoms of anemia, including bruising, petechiae, excessive fatigue, headache, or dizziness? Is there a family history of a bleeding disorder? Has she had any past surgical or dental work-related bleeding, bruising, nosebleeds, or any frequent gum bleeding? Any abnormal pap smears? And then when was her last pap smear? And then review of systems for any other bodily changes or abnormalities, such as ovarian cyst, recent illnesses, infections, or chronic illnesses. A lifestyle evaluation to include any eating disorders, any weight change, like has she always been kind of on the heavy side, or has this been a recent weight gain for her? Did she used to exercise and now she's gained weight so she doesn't feel like it, or what is her exercise program? Any life stresses that she's going through, any illicit drug use, any smoking, and if she does smoke, we can't put her on COCs. And then does she use alcohol? And then does she take any prescription or over-the-counter drugs, such as warfarin, heparin, NSAIDs, hormonal contraceptives, or any over-the-counter vitamins and herbal remedies such as ginkgo, ginseng, or motherwort? And then objective history, objective data, sorry. We're going to do her vital signs and then a complete physical exam to rule out other pathologies. So we're going to do a general survey of her skin and hair. We're going to check her neck and her thyroid, her breast, see if there's any nipple discharge, abdomen, her genitalia, and then we're going to do a pelvic exam, both speculum and bimanual. And then I'm going to check the site of her bleeding and see if I can see where the bleeding is starting or coming from, and look at the cervix. And then if there's any tissue that she's passing, we can send a specimen to pathology. And then assess the size, contour, and tenderness of her uterus and her ovaries. And then labs and diagnostic testing. HCG, we're going to do a TSH, CBC with platelets, do STI screening, coag studies, which would include D-dimers, PT and PTT, factor 8, von Willebrand factor, antigen, and activity. We're going to, if virilization is seen by myself or she reports it, I can do androgen studies, which is DHEAS, cortisol, and testosterone, We'll also get prolactin, FSH, estradiol, pap test, and then an endometrial biopsy. It says that you don't need to do it if the patient's younger than 45, but to do it if she's obese, and our patient is obese. So we're going to go ahead and get an endometrial biopsy. And then an ultrasound to look for structural abnormalities such as a cyst or fibroid. And then if I do see something, might just go ahead and do a hysteroscopy to visualize the endometrial cavity and endocervix. My assessment is that she has dysfunctional uterine bleeding. And then my plan is for pharmacological interventions, I would tell Adeline that she can take NSAIDs for the pain and the cramping. And then I would put her on a COC, like I said, if she isn't a smoker. I wouldn't put her on igestion yet because we don't know the cause of her bleeding. And to prescribe that, we need to know exactly what the cause is. But that is a good drug. I read about it. Non-pharmacological interventions, Adeline should be put on a low-calorie diet. She should start an exercise program for her obesity. As we know, obesity has been linked to abnormal uterine bleeding. She should also be eating lots of green, leafy vegetables and also colorful vegetables, and lots of fruits and healthy fats. And she should be avoiding unhealthy fats, bad fats, and high carb foods. And also she should avoid soy products. And then I would educate Adeline about her normal menstrual cycles and possible reasons for her abnormal pattern. Menstrual calendars could be helpful with her to documenting bleeding or spotting. And then also it could help her, we could educate her on old carts and see like when she's, when the onset of the pain is, where the location of the pain actually is, how long does it last, is there anything that makes it better, makes it worse, what she can do to relieve that pain. And if she has taken the NSAIDs before, ask her if they're helping her at all. She can also use heating packs for her pain. And then I'll educate her and tell her that we will be wanting to see her for a follow-up. And then also educate her on the importance, if I do prescribe COCs, to take them at the same time every day, take them with food, and start the pill pack on the first Sunday after her period starts. And then referrals, she doesn't really need anything except if there are structural abnormalities or if her pap shows cancer cells, we'll want to refer her to an oncologist. And for the structural abnormalities, maybe a GYN surgeon. And then follow-up, I'd like to see her in a week to check on her bleeding and also discuss the results of her physical exam and any labs or diagnostic tests that I did. If we need to change the plan of care at that time, we can. And then I'd like to see her again in 3 months. All right, thank you.